Alright, so we are doing a wet to dry change. So first, I am using this paper towel as the old dressing. So the dressing cover and the actual gauze inside. So this is the whole thing here. So before we start, we check to see if it's ordered through. If it's ordered, the orders are through to do this. So once this is done, it's ordered through. We check the patient's medical chart. We get all the equipment ready that we need for the dressing change, wet to dry. We come in the room, perform WISER, wash our hands, inform the patient, to tell them who I am, check 2 verifications with them, raise the bed to a good working height, screen for privacy, and just explain to them what's going to happen today. So after that's done, we put on gloves. So the first thing that you want to do is to take the old dressing off. So when you take the whole thing off, pinch the whole thing, pull it up. You examine it for smell to see if you have any odor coming from the dressing at all. The collar, the odor, any kind of drainage on it. So then you want to assess the wound for any tunneling, granuling, Eskimo, like the eschar, drainage, how the appearance is, how the wound is. If it's a dull collar, don't touch it. If it's dull collar, smell the odor, like I said, tunneling, graining, or tunneling, edging, like with the ridges, and make sure it's like beefy collar, like a beefy good collar. You want it to have good blood flow. So you're discarding this. As you discard that, you do want to have a little biohazard bag. So we're going to put this to the side over here. I'll put the biohazard bag down here. So we are discarding this down to the biohazard bag, which is the old dressing. To do that, take out the old gloves, wash your hands, and you're putting on regular gloves. So once you have regular gloves on, these are my sterile gloves. The sterile gloves in the package don't fit me, so I'm gonna do the best I can to keep these are in the sterile field. And if I do not, I will change sterile gloves. So I'm gonna put these to the side for right now. So move this. This is my sterile kit. So I'm gonna open the sterile kit and remain into the sterile field. So once I open, I got an inch border. Put this around. And said before we even start the sterile procedure, most of the time they don't have saline into this, so you might have to bring your own saline. So mine's on the outside, which is not sterile saline. So before I even start, I just want to go ahead and lip it to make sure I get that done so I don't forget. So I'm going to lip it in the trash can, put the lid back on. Regular gloves. So with the regular gloves, I'm just going to tip the stuff out without touching. Once it's out, so I got a little more. That's still in the sterile. Still in the sterile field. So I'm gonna have that out. I'm gonna put it to the side. And I'm gonna take the bottle across in the sterile field. I'm gonna take the bottle, turn it this way a little bit, and I'm gonna lip without going across. Lip, lip, lip. Just go and fill them all up. Put it back here. So, while I lip it, I'm going to take these gloves off. I'm going to take the old gloves off, and so I got to move this over to show you the sterile gloving. So, right in front of the sterile gloving, I'm just going to move this over for a minute. This is all in place. I'll move this over for a minute. I'm putting it back into place once I'm done. I just don't have the field to work with right now. So everything needs to be above your waist. Any skill you perform, you want it above your waist, especially sterile skills. This is what I'm working with now. So just pretend this is above my waist. Take sterile glove, put it on my hand, put it out in front, and above the waist. Take it on, you can fix it once it's done. Do not touch the outside. under lip, the other glove. Put your hand on it, put your thumb in, hand in. You can fix it when it's on. So they are out in front of me. They're all on good. Take this, throw in the biohazard bag. Remember, you want to keep your hands above your waistline, above the table. So if you ever touch anything or touch your clothes, redo your gloves, sterile gloves. So I'm gonna place this stuff back. I'm staying sterile. I'm just placing it back to the original position it was where I had the ring. So this is the original position there was. So first thing I'm gonna do, sterile gloves. I'm gonna turn the phone over here. Okay, so we are going to place, I don't need these bands, so I'm going to throw them to the side. The tape, I do not need this. I can also throw it in the bag. You do need this to cover at the end. You need your gauze, sticks. So and this is the biohazard bag, which I already have one. So before I start anything, if you had the saline to irrigate the wound, if you don't have the saline, irrigate the wound at the very beginning and pat it dry before you start this procedure. So I do not have the saline in the pack to put into my tray or to irrigate the wound. So I would use, for now, I'd use for now, just say I irrigated before. So I irrigated the one before, I patted it dry, so it's patted dry already. So I was trying to make sure I didn't have any stuff in here. So anyways, I'd pat it dry already, and then I would open the whole sterile kit, done everything I just did. But sometimes they do have sterile irrigation in here, the saline. So what I'm gonna start to do is take these, the ones I'm going to put in wet. I'm going to put these into the saline. I'm going to get them wet. Take one at a time. Put them into place. Make sure you don't let it touch the outside. So if it touches the outside, so I'll take one more, put it on, stuff the wound. I said, make sure it don't touch the outside, make sure it stays in the wound. So once it's on, put on dry 4x4s to cover it up. Once that's on, blue side up, the bandage. You want to tape, one across, one down here, one to the side. After you do that, if you don't have a label, take another piece of tape. This tape in particular will not work, so you will have to have a piece of paper or some type of label. You could probably write on this, or time, date, and initial when this was actually put on. And after that, you're done. You throw away all the equipment that you didn't need, and you're done.